Hey everyone, welcome back to the second part of the third lecture within social medicine. And so we continue the epidemiology lecture, and so now we are focusing on epidemiological studies. Now, the two main studies that you need to know consist of observational and experimental. The main difference between the two is observational. Here we do not intervene in the study. Alright, we are only observing the study and describing. So we got descriptive studies, which is our first subgroup, and secondly we have our analytical group, in which we can compare our group with a control group or a comparison group. Alright, with the descriptive, we cannot compare our group. We cannot compare our group with another, or we cannot compare our group with a control group. Okay. However, in both of these, descriptive and analytical, we cannot intervene in any way. Okay. However, in experimental studies, we can actually intervene by introducing, let's say, some new factor in which we wish to actually observe and see if there is an actual change in the effect within the epidemiology. Alright, but we will get into that in a few minutes. So first we will begin with observational studies. Okay. So first of all, here are all the epidemiological studies. Well, most of them at least. These two here are a part of descriptive studies, and this falls under observational. Ecological studies we do not need to know, so you can forget about that. These three, cross-sectional, case control, and cohort, the triple C, this is a part of analytical, which again falls under observational. And finally, you can see the reason why experimental group we can intervene. It can be alternatively named as intervention trials. Alright, so intervention trials, same as experimental studies, due to the fact we can intervene. This is our experimental group, and the experimental group has randomized controlled trial, field trial, and community trial. Alright, so first of all, we are going to be focusing on the descriptive subcategory within observational studies. Now, what is case report, which falls under descriptive studies? Now, first of all, case reports, what this report does is we basically focus on one individual person. Alright, we're not focusing on a group of people here. We're not studying a group of people here, right? We're only focusing on one person. Alright, the main benefit we get out of this is that we can observe rare diseases. The main purpose why case reports exist is for analyzing rare diseases or researching new diseases which are usually rare. Now, the advantages here is that with this type of report, we can actually, find out new diseases, and this can form a bridge between the lab and the actual clinic, in which doctors can add this to their arsenal in if they meet any of these diseases in the real world. All right. And another advantage is that it can inform other doctors as well, inform doctors on the things like the etiology or potential treatments. All right. So, as you can see, it gives us information about development, treatment, serves as a bridge between the lab and clinical research. I think that's more than enough. However, the disadvantage here is that we are susceptible to bias because of the relatively small number of cases, and also this type of study is susceptible to uncertainty. All right, just because of the limited kind of knowledge and the rarity of this study, finding these cases, it's got high uncertainty and the bias is high. So it's got a lot of bias and a lot of uncertainty. Alright, so in summary, case reports are basically these individual studies, individual observational studies in which there is no comparison group, no control group. We basically look at these one individual or very few individuals and just basically observe their disease, and usually it's a rare disease. All right, it's going to be something that's going to be worth the effort of following one person. Now, with a case series, I don't think it mentions here, but there's something called a case series as well. So we got case report, and then we got case series, and I think the main difference here is that case series we can actually investigate more than one. Here is usually just one individual. Case series we can focus on more than one. All right, so that's our main two types of observational studies which fall under the descriptive category. Descriptive meaning no comparison or no control group. And like I said, we will skip ecological now. We will do the 3 C's which come under analytical. Now with analytical, the difference here is that we can actually compare this with our control group. All right, and first of all, cross-sectional studies. What is this? So cross-sectional studies, as we know, is an analytical study, and it basically allows us to make some hypothesis about the etiology of a disease, the etiology of an occurrence of a disease. All right, and how we do that is by an analogy of this pie. All right, so the whole pie, you can say, is the population, and we're interested in a hypothesis which is X, and obviously from social medicine last year we learned that taking a sample is more convenient in order to test a hypothesis in which we can actually project back to the main population. Alright, so once we do this, we can actually project it back to the whole population. And so this is what we're doing here. We're taking a slice of the pie, which is the sample. We are doing our study on this sample, and then we are inferring this back into the population. Alright, so here, this study is, so I mentioned before there are types of studies called prevalence studies, and there's studies called incidence. With prevalence, we are not interested in time. Time's not a factor. Alright, so here we are not focusing on incidence, we're focusing on prevalence. Alright, we do not measure time. Alright, so what are the advantages and disadvantages? So the advantages here is that it's easy to organize, and the important thing is we can generalize. By taking a sample and projecting it back to the population, we can generalize our findings. However, the disadvantage is that, like I mentioned, being a prevalence study, there's no time dimension. Now, the reason this is important is because without time, we cannot have a causal relationship. You need an incidence style study to be able to confirm that there is a causal relationship. And so only studies like cohort studies can only prove that. Alright, with a prevalence study we do not have time, and so we cannot prove a causal relationship. We cannot prove that A was before B. Only time can allow us to figure that out. Alright, so that is our main disadvantage here. Alright, and also you could say selection bias is an issue unless you properly unless you properly choose your sample, i.e., through maybe systematic sampling or some other sampling method. Alright, now cohort studies. Again, this is a analytical style study in which we can compare with a control group. Alright, so we have a population at risk. Hopefully you can see this. So you have a population at risk here. We got a sample, and within the sample we have a group that has an exposure to a risk factor, and we have another group that is currently not exposed to a certain risk factor. Now, the interesting thing here with a cohort study is we get our sample and we basically let them go and we observe them through the future. So there's a time element here. And we basically observe them, and then we, after a period of time, follow up, and then we look at any changes that have occurred through that time. So you collect data and you make a risk assessment. Now, the important thing here, both groups have to be healthy. That's important. The only thing that should be different is that one group should be exposed to a risk factor and the other group should not be exposed to a risk factor. All right. Now, advantages and disadvantages to this kind of study. Here, this is suitable for rare exposures. All right. So, say for example, a group lives near a nuclear power plant. Now, this is an advantage because we cannot directly cause harm to an individual taking part in a study. However, if they are already living in a certain area or already exposed to a certain risk factor, then it's not something that's on the fault of the investigator. All right. So say we have a nuclear power plant here and there's a population living nearby. All right. That's one population, and another population is living somewhere else. After a period of time, we can go back and observe those people. And the people near the nuclear power plant, they may have some disease that is due to something from the nuclear power plant emission. And so this is what it means by rare exposure. We can find diseases that maybe generally, commonly, we wouldn't normally be able to find. Now, because we have time, because this is an incidence type study, because we have time, actually let's change it. We can actually detect a causal relationship. We have time now. It's an incidence relationship. Incidence. All right. And some disadvantages is that firstly, it's time consuming, of course, because you have to wait a certain amount of time in order to get your results. All right, time consuming. And secondly, it can be expensive. And yeah, large populations is needed to make a more representative sample. Now, with a case control study, this is the opposite. And so instead of a prospective study, which was the cohort, we have case control, which is a retrospective study. And so now we are going into the past. So how this study works is that you have a sample of people who already have a disease or something, a case of any sort. All right, so you have the case, you have it already. But the thing is here is that you're going back into the past to determine the exposure. All right, so this is the opposite. So what the cohort study would do, they will focus on the exposure, right? And from exposure, they will over time judge how exposure can lead to a certain case being formed or case formation. However, this is the opposite, and so it is a bit more tricky to do this. So again, the only difference here is that there should be one group that has a case and the other group should. So one group should have the case, the other group shouldn't. Everything else should be the same, i.e. socio-economic factors should be the same because we want to keep consistency between both groups. Alright, so this can bring up challenges, this study. Some disadvantages is that, one, you need all medical records available, right, in order to do something like this. And because you're going back in time, it's hard to establish a causal relationship, because normally a cause leads to an effect, but we're focusing on the effect and trying to establish the cause, right? So it kind of makes things a bit more tricky if we do that. Alright. And so we can see here difficult to establish this causal relation. And also one more thing, it's not suitable for rare exposures. I don't know exactly what that means, to be honest. I don't know. It's something just to know. And some positives. What are the advantages? The advantages is it's alright, that's very weird. It's suitable for rare diseases, but it's unsuitable for rare exposures. Yeah, I'm not too sure about that. And some other advantages, is there any other? It's just cheaper, I guess. Cheaper and quicker. Yeah, definitely. It's fast. The reason it's fast is because we have the cases already. We have them like directly straight away, right? Whereas in a cohort study, we had to wait a certain amount of time to get the cases, remember? So you had exposure, then you had to wait a certain amount of time, and then you would get your case. Obviously, this took time to get the case. Here, we're going backwards. And so here we have the case already, and so it's quick. We can do it straight away. All right. Now, the next type of study here is intervention trial. Now, like I mentioned, another name for the intervention trial is the experimental study. Experimental study. And so in this study, here we have two parts. One is that we can have an experimental group, and secondly, we can have a control group. Alright. And within the experimental group, we can actually intervene. We can control the exposure. And so what an intervention trial is, it's basically a follow-up study in which the exposure to a risk factor is investigated. Alright. And the exposure is evaluated with the introduction of a new factor. We are intervening with a new factor. So if we're focusing on how A can cause B, but we want to see how C can actually help mitigate A causing B. So this is what this study aims to do. So what are the three types of interventions, or C's, if you want to say in this diagram sense? We have three types. We have the prophylactic, intervention, we have the diagnostic intervention, and we have the therapeutic intervention. Now, the prophylactic intervention is about mainly preventing what would be B over here. So we're preventing a certain outcome. We want to prevent a certain outcome, and that's usually a disease, and this occurs through things like vaccinations. Next is diagnostic. Here we try to evaluate new diagnostic procedures. Evaluate new diagnostic procedures. Alright, so basically we have a certain machine, maybe a new MRI machine, a new CT scanner. We're trying to evaluate new diagnostic procedures. Alright. And so in this sense, we want to, instead of mitigate B, if C was a diagnostic intervention, we want to see how well we can identify B through the exposure of A. And finally, we have therapeutic. Therapeutic focuses on treatment. And so you can guess here we have drug intervention. Alright. So that brings us onto main type of study within the experimental study, and this is the randomized controlled trial, randomized clinical trial. Well, actually this is just named clinical trial. And within clinical trial we have three ways to make the trial more stronger and randomized, blinded, placebo controlled. They're all different ways to make the clinical trial more, let's say, stronger as a study. Alright, less, to make it less bias within it. And the best combination is everything here: randomized, blinded, and placebo controlled. All these three things is best with a clinical trial. Alright, now I'm not going to go into the different types of control groups you can have, but you can remember that there can be placebo. Alright, so one group has the drug, another group doesn't. You can have two groups in which they both have a dose, two groups different dose. Alright, you can have two groups again, but now one has a dose and two has nothing. You can have another type in which there's two groups, but one has treatment, which is current, the diagnostic intervention we're trying to bring to market right now, currently what you're testing. So that's treatment, and the second group has existing previous treatment that's being outdated with this new treatment here. So existing treatment. Alright, and finally you can have two groups, and one group has a treatment, but the second group gets historical data. I'm not too sure what they mean by historical data. Maybe historical treatments, I'm not too sure. But yeah, those are your 5 different potential control group configurations. Alright. Now, just to circle back to types of intervention trials, we have 3 types of intervention trials. I'll put it here. Three types of intervention trials. Number 1, you have clinical trials. This allows us to test new methods for screening and prevention and diagnosis and treatment. Alright. Screening, diagnosis, treatment, that sort of thing. Alright. So with a clinical intervention trial, this is about how we can improve clinical the clinical environment, alright, through clinical trials. Alright, secondly, we have community trials. So as you can imagine, these are trials that occur in the community. Clinical occurs in clinical environment. Community occurs in a community environment. So it's basically done in a realistic setting. Alright. And third, we have the lab experimental trial. Lab experimental trial. So here we are researching on animals and tissues. So these are the 3 types of intervention trials. 3 types of intervention trials here, done in different situations. Alright. So finally, let's look at the 4 phases in the random control trial. First, we have phase 1. Phase 1, what we're trying to do here is determine the non-toxic dose. Non-toxic dose, that's what we're trying to do. And we do this in animals or healthy volunteers. Alright, so that's what the first phase is. Second phase is we're testing the efficacy of the drug. We have 2 sub-phases. Here we test in 2A, dosing requirements. 2b, here we are testing the efficacy. Alright, so dose and efficacy. Number 1, toxicity. Tox, dose and efficacy. Third one, we are comparing old and new drug, and we're also looking at the side effects. Alright, and also here, these institutions, these companies, they can register for market approval. Alright, basically sponsorship. And finally, phase 4, the drug is on the market. Alright, and also here we can test the long-term effects of the drug, because obviously the drug hasn't been on the market for a long time, and maybe some drugs have long-term effects and also effects in different situations. Maybe the drug hasn't been tested with someone who's had, somebody chicken wings and a cheeseburger. Alright, how does a drug interact when you have different types of food? Or maybe there's an allergy, undiscovered allergy. So it uncovers different things that maybe couldn't be previously available. Advantages and disadvantages. Advantages here is, with this type of study, we look at causal relation. It allows us to look at causal relation because we are doing an incidence type study. We can look at long-term effects. Alright. However, the disadvantages here is that it's costly and time consuming. Alright, so this is, I think, most of what we need to know. Most of the information that we need to know. Yeah, this has been quite the lecture. So yeah, I want to leave it there. And yeah, I want to thank you if you have watched all this way. And yeah, hopefully it made sense, and I'll see you in the next video.